Hi, and welcome to Hear the Rare Voices of the DIPG community. My name is Rachna Prasad. Today, for episode 8 of Hear the Rare, we have Cassie Kline, an attending physician and director of clinical research in the Department of Neuro-Oncology at Children's Hospital of Philadelphia. Dr. Cassie Kline is also the Assistant Professor of Pediatrics at the Perelman School of Medicine at the University of Pennsylvania. Dr. Kline specializes in the care of children, adolescents, and young adults with brain and spinal cord tumors of all types. She has a Master's of Advanced Studies in Clinical Research and focuses her career on early phase clinical trials and developmental therapeutics for pediatric brain tumor patients. Dr. Kline's other research interests include predictors of neurocognitive outcomes in pediatric brain tumor survivors and personalized and immunotherapy-based approaches for treatment of brain tumors. Additionally, Dr. Kline serves as the Director of Data Quality and Integration for PNOC, overseeing the consortium's data collection processes and also integration across a variety of data platforms and research collaborations. Here is episode number 8 of Hear the Rare. So I guess my first question for you would be, can you share a little bit about your path to becoming a doctor, and then also how you got introduced into the DIPG and DMG world?
Sure, yeah. So I'm actually the first in my family to have gone to college and obviously then medical school. And I was interested in becoming a physician honestly as early as I can remember. And I wish I could say what triggered that or what motivated it. I honestly don't know. I remember as long as I could tell that I would tell people I was going to be a pediatrician when I grew up. So for whatever reason, there was something in me that told me I was going to be in pediatrics. And then I went to college and I paid for most of my college with some supplement from a bit of family support, some supplement from grants and scholarships and things like that. But for the most part, I worked almost full time throughout college. And so because of that, it was just challenging to do all full pre-med medicine requirements as, college prerequisites go. And so I ended up going into a master's of teaching program because I just kind of got a little bit discouraged and was like, well, maybe I can't do this, maybe I'm not going to be able to handle all of this. It's hard enough as it is, and how would I even pay for medical school, et cetera. So I was in the master's of teaching program for about 1.5 years, but I just kept coming back to wanting to do medicine. And at the time I was a biology major. I was planning to do like high school science teaching. And because I just kept coming back to it and someone in my life was finally like, I just don't even understand why you're not doing this. Like, you keep saying you want to do this, like you should just do it. There is a path forward, if you want to do this, you can do this. And so I ended up dropping out of the Master's of Teaching program and then graduating on time, but ended up enrolling in a post-baccalaureate program to finish all my pre-med requirements, and then took the MCAT, applied to med school, and ended up having 3 years of gap time between college and going to medical school. And then I knew, like I said, I always wanted to do pediatrics, and I had an inkling I wanted to do oncology, just because I liked the pathophysiology of it and the biology of it. But then my mom ended up getting lung cancer when I was in medical school, and just kind of going through the path with her really solidified the fact that I wanted to also be present and help people go through that journey myself. And she ended up dying of lung cancer. And again, I think it was just that process of from beginning to end and seeing the impression of good medicine versus not so good medicine that really convinced me that was what I wanted to do. But it didn't, it never steered me away from pediatrics. I always still knew I wanted to work with children and young adults. So that was really how I became a pediatric oncologist.
Mhm.
So it's a little bit of a long story, but
No, thank you for sharing. I think it's always really nice to see that like it's not a linear path, especially like as I'm like figuring out my master's stuff. I feel like there's a lot of people who are just like, oh, like college, med school, like become a doctor. But it's nice to hear success stories of people who didn't necessarily follow that.
yeah.
So,
And I think that it really augments their ability to relate to people down the line too, because it
yeah,
just affords you a little bit more time to have life experiences that are unique and
yeah,
different, and you know, gives you a little bit more ability to feel grounded.
yeah. No, I
I always
definitely, yeah.
worry about my colleagues that just go straight through that, like school is their life, and that's how it's always been, you
Yeah.
know. Like, I always want to be like, go out and see the world and live your life, and like, you know, we have 40 years to live medicine, so
Yeah, no, I feel like that's what I was also worried about getting stuck into when I was kind of figuring out my whole thing. But and then was there like, did you come to like meet a DIPG patient during your like, um,
yeah.
I guess rounds, or where did that
Yeah.
happen?
So that's another. So I ended up at UCSF for my hematology oncology fellowship,
Mhm.
and I had not settled on neuro-oncology by any means. But within the first 3 months as a fellow, I was actually just serendipitously ended up doing my neuro-oncology rotation pretty early on,
Mhm.
and you know, the one I met a 9-year-old boy with glioblastoma who just really changed my life in that interaction confirmed that I wanted to make, you know, pediatric brain tumors my career long term. And I think, you know, the field was, when I was first starting fellowship, it was just changing so quickly. There's so many different therapies coming out, immune-based therapies, targeted therapies, but yeah, so many questions that remained in terms of how these were going to translate to brain tumors, and you know, what impact they were going to make. And at the same time, there was this field where there's just been so much effort over decades, and yet unfortunately, like, so little progress in advancing survival and advancing outcomes for so many of patients with brain tumors. And certainly high-grade gliomas, diffuse midline gliomas, diffuse intrinsic pontine gliomas, they're the, you know, the apex of that in terms of just having such poor outcomes despite so many efforts and trials to change that. And so I think all of that really motivated me that this was a field I wanted to invest my time and effort and energy in, and that this was a patient population, again, that I just really felt there was so much room that we could be doing better, and there's so much potential.
Yeah.
And hopefully that we were on the cusp of being able to make that impact. And as a fellow too, I joined UCSF, I think, right when the Pacific Pediatric Neuro-Oncology Consortium was gaining traction at UCSF. And certainly, you know, some of the first patients I met as well were on PNOC 003, which was their precision-based medicine trial for diffuse intrinsic pontine glioma. And so I think just meeting those patients and early on, really becoming immersed in the disease and the patient's paths, I think that was kind of it for me. And I knew that there was no doubt I wanted this to be a part of my life, and I wanted to be a part of ideally making things better for these patients and families.
Yeah, no, I definitely think there's a lot of, I don't know, like a lot of space to do more. And it's like so many people are working together on all of this stuff. And it's,
Yeah,
you know,
it's very exciting right now.
yeah, yeah, I definitely agree. And I guess with that in mind, what area of research are you involved in? And is there currently something you're either working on or like excited to be working on in the future or anything like that?
So, I mean, I am definitely a clinical trialist. And so, you know, my job, of course, is to work with basic science researchers and other clinical trialists and translation medicine investigators and really get what's happening in the lab to the patient. And so in that regard, I really, really do enjoy writing protocols for clinical trials, helping bring together novel treatment strategies, helping or collaborating rather with biostatisticians to bring together novel biostatistical designs. And I think to piggyback on what we were just saying about kind of all of these teams and investigators and researchers working together now, I think in my mind, that's really what I'm very excited about, is the fact that more than ever, I really feel through some of the platforms and the collaborations across consortium that have come together through PNOC and through the Children's Brain Tumor Network and through all of these other disciplines and investigators, everyone really seems motivated to not only be wanting to work together to find a cure, but to think about novel strategies and to make sure that what we're bringing to the patients is based in the most solid, promising evidence that we can put together. And to also be thoughtful in our trial design so that we're not, repeating the same or not running into, I guess, the same hurdles that maybe slow down progress or delay progress or, lead to unnecessary effort spent on therapies that maybe don't translate the way we expected them to. Additionally, I really do think that the recent effort and motivation to look at things in terms of the impact on quality of life for patients as well is really important. I think is really novel. I think historically we have tended to focus on, looking at pharmacokinetics of a drug or maybe early signs of clinical impact based on survival or disease control. But particularly with patients where we're already dealing with abbreviated spans of life, I think it's paramount to focus on what we're doing in that span and how we are impacting the patient and the family. And having this feedback so that we provide a platform and a mechanism that patients and families can let us know as well. Not only do we think this is working for a patient because maybe it's having tumor effect, but is it working for a patient and family without being excessively burdensome on them?
No, I think that's something I've heard more people talking about, and that's really exciting, especially as a family member too of a patient. It's definitely, I think, obviously hard for the patient and then also their family to take care of them in some of these situations. So when people started talking about that more, I definitely, it makes me very happy that that's being considered more and more.
Yeah. And I think this is exactly the feedback that we as clinicians and investigators get and hear from patients and families. Is we don't want to take any of that precious time away from families, right? But at the same time, we all want to work together to make sure we're fighting as hard as we can.
Definitely.
Not losing sight of what the bigger picture is.
Yeah, I definitely agree. And so I guess in terms of the patients that you've seen, or is there one moment that stands out to you, maybe not necessarily the patient, but just in your career that you're this really changed my perspective, or this really opened my eyes to something?
I don't know that it was, I would say obviously there was, seminal encounters where I was this is what I want to do with my life. This is where I wanted my career to go. But I just think more than anything, it's just the cumulative experience of patient and family interactions. And perhaps having my own child as well. I think that was actually really impacting as a provider, because for so many years, obviously I did this without having a child of my own. And I think, coming back to work after having a child was, made it even so much more personal. Obviously, like I have never gone through what my patients and families have gone through, but I think the empathy and like the ability to more personally grasp, like, you know, the pain that this diagnosis carries. I think that really made a big impact for me personally in terms of, again, just motivating why we get up and do this every day, and looking at my own son and being like, what would I want if this happened to me? So.
Yeah. No, I never even thought about that changing your perspective as a doctor, actually. But yeah, no, you're definitely right. And then also, obviously, this line of work cannot be easy. And I'm sure you do have like these really like tougher days, especially when you do meet a lot of like terminally ill patients. So is there anything, or like, how do you get through those harder times, I guess?
So I do love to work out, and I don't work out as much as I would like, but I have to always put in a plug for that because I just think that's really good for my personal mental health. So I use the weekends to get kind of clear my head, you know, get my anxieties and my stresses out. And that's always been beneficial for me, but also I'm fortunate to have a wonderful family that I get to come home to in the evenings and on the weekends too. And, you know, the little things like having that time together as a family, getting outside, you know, the normal stuff that I think the benefit of our job in some ways is that I feel we don't take anything for granted. And that when I'm on the playground with my son on a Saturday, I am so all of that in, like perhaps more so than anyone else, because I just know how that can be so fleeting. But I also take those time and those periods to, you know, rejuvenate me and replenish me a bit. So.
That's, I actually feel the same way about exercising. It's kind of how I let out my stress too. So I definitely relate to that. But, and then I guess lastly, where do you think the DMG research is headed, or where would you like to see, I guess, based off of what we've talked about previously?
No, I mean, I think I just want to continue to see the multidisciplinary collaboration that's already ongoing. You know, certainly we have clinical trials and working group efforts that are bringing together all of these different types of specialists and experts from across the world, and coming together with novel clinical trial designs, novel combinations, and pushing the envelope, but in a way that is built on a solid scientific foundation and utilizing efforts that, you know, are really spanning the globe. So, you know, I really truly believe that's how we're going to make progress with this disease. And I'm just really excited to see that under amazing leadership, not my own, but under amazing leadership, these efforts are coming to fruition. And I'm just happy to be a part of it, to be honest.
Yeah, no, it's definitely exciting. I love, and I feel like it's become more of a really large thing, like collaboration in general recently. Like I think almost every physician or researcher that I've like talked to for the podcast has said the same thing, that they're excited about the collaboration. And that's like really exciting to see that everyone, for the most part, is kind of like on board and excited about this. It's really hopeful.
I think so too. And I think, whether it be because of, you know, the advent of more connectivity as technologies have advanced, whether it be because, you know, COVID has forced us to have, you know, learn how to function in these remote meetings and remote settings. But I just feel like even in the last 5 years, the silos of research have really started to break down, make way for some of this sharing of information, sharing of data. And you know, I think that everyone that's involved in this work is so intrinsically motivated beyond kind of their own personal gain. And I think you just see that as the technologies and the platforms are allowing us to bring together all of our work and efforts.
Yeah, no, I definitely agree. And it's really, I think it's very exciting and hopeful for families, I think, as well, to see that people are no longer just doing it for themselves or doing it for their own like career and things like that. But yeah, that's all the questions I actually have. But thank you so much for taking the time to talk to me and answer all my questions.
Thank you so much for having me on and questions. And I just, thank you so much for your effort and for continuing to bring awareness to this disease and for also sharing your experience. And continue to motivate us to do better.
Thank you so much, Cassie, for joining me today. And thank you for sharing your story as well as your journey. As always, please like and subscribe. We have a Facebook page, an Instagram page, and a YouTube channel as well. We are also found on various podcast websites for the audio version of this interview. If you or someone you know would like to be a guest on Hear the Rare, please reach out on our website, heartherare.com, or by emailing us at heartherare@gmail.com. And finally, for today's gratitude, I would just like to say thank you to all our new listeners. You help us grow every single day, and it truly means a lot when someone decides to listen to this podcast and get to know more about DIPG. Thank you for listening, and see you next time on Hear the Rare.